Okay, this is Mitzi. We're going to pain score Mitzi just now. She's a little Cairn Terrier, and you'll see when we take her out, she had surgery on her stifle yesterday. What we need to know when we're going to pain score a dog is, have they had anything painful in the recent history, like surgery, and also what medication she's on, what analgesia she's on. And I know from her record that she last had analgesics, methadone, at 8 o'clock this morning. The first part of the pain score involves looking and watching Mitzi without really interacting with her, just in the kennel. And so that's what we're going to do first of all. There's two things we're looking for really. We're wanting to see, is she vocalising? And also, is she paying any attention to the wound? For the next part, what we're going to do is we're going to take Mitzi out of her kennel, see how she moves around. Now clearly this is not something we do in an animal that's had spinal surgery or is recumbent, had serious traumatic injuries where we don't really want to move her. Good. Okay. Now we're just going to, oops. Just come down here, Mitzi, good girl. And then back again. Mitzi, come on, sweetheart. This way. Come on. Good girl. That's a good girl. The next part of the pain score, we seemed a little bit cruel, but what we want to do is actually touch the wound. And I think it's quite important because it gives you quite a lot of information about how that area feels. But the key is to start very gently, just with very light pressure near the area of the wound. Now what we're looking for is any response from her. You can see even with very light pressure, she's kind of looking round at what I'm doing. Take a little bit more of a hold. Good. Now the final part of the pain scoring process is to look at everything that we've seen up until this point and make an overall judgment. What we do when we've scored all these different areas is we add them up, and the score that we achieve can give us some idea of whether analgesia is required.